Good morning, team. My name is Jamie Whitty. I am doing an article on acceptance and commitment therapy, and the article's name is An Acceptance and Commitment Therapy, otherwise known as ACT, Group Intervention for Cancer Survivors Experiencing Anxiety at Reentry. During this presentation, I will discuss the following things. I want to talk about why I chose this article and how it relates to ACT. What information does this article provide to its readers? How does acceptance and commitment therapy play a role with cancer survivors? Research and findings. Of course, the conclusion. What did the research say? As well as your thoughts. So why this article? Well, everybody has dealt with cancer, whether you dealt with cancer personally or you know someone who has cancer. You may know a cancer survivor. I know a few people myself who survived cancer, and unfortunately, I do know some who didn't. I can tell you that knowing people who survived cancer, there's always a fear of cancer coming back. The questions are always in their minds, such as how, why, is this going to be a death sentence this time? This article takes a look at acceptance and commitment therapy and how it helps cancer survivors. So what information does this article provide? Well, this is actually a great article. This article discusses a study that was done out of Boulder, Colorado, where 42 participants were studied on anxiety levels during the reentry stage of cancer. This stage is when you go from active treatment stage to post-treatment stage. The authors of this article, along with research done through the University of Colorado, used a behavior-driven approach with these cancer patients. The approach was acceptance and commitment therapy. So why ACT? Because it is an empirically based psychological intervention that uses acceptance and mindfulness strategies along with commitment and behavior changes to increase psychological flexibility, as well as increasing psychological flexibility with the outcome desired with these cancer survivors. This study became the first known effort to adapt ACT with cancer survivors. How does acceptance and commitment therapy play a role with cancer survivors? So why use ACT with cancer survivors? What would be the end result? Research has shown that using ACT with cancer survivors minimizes their distress of cancer. ACT promotes forms of coping that predicts positive psychosocial outcomes among cancer survivors. ACT decreases fear of recurrence and fear of mortality. So in the end, with ACT and how we look at mindfulness and changing behaviors, this led to helping cancer survivors live more meaningful lives. So let's talk about the study and results. First of all, the method used. Researchers surveyed 42 patients that were being treated at the Rocky Mountain Cancer Center in Boulder, Colorado. These patients had to have just completed their cancer treatment. So again, they were going from active treatment to post-treatment, known as reentry. They had to indicate that they had high to severe levels of anxiety at that time. They could also indicate that there could have not been any signs of sickness or cancer in the body. These patients were given chances to participate in 7 weekly sessions that were in 7 weekly 2-hour sessions. The participants were divided into 4 groups, and the 4 groups depended on how much they participated in these sessions. Measurements were used mid-therapy, after therapy was completed, and then 3 weeks after the completion of their therapy. Patients were given anxiety tests such as the STAI, known as the Spielberger State Trait Anxiety Inventory, and the Patient Health Questionnaire for Anxiety and Depression. Research was also backed by the American Cancer Society and was done by therapists using acceptance and commitment therapy. Results were in favor of the researchers. Not only did ACT help cancer survivors lower anxiety and stress, but there was also robust improvement with quality of life, Patients were less fearful of cancer coming back, and there was less fear in mortality. Patients were living more meaningful lives without the fear of reoccurrence. So in conclusion, the study was done within a community-based cancer care setting where researchers examined ACT's preliminary feasibility, acceptability, efficacy, and mediation by psychological flexibility. ACT led to moderate to large improvements in cancer-specific and broader outcomes. Yes, this study was one of the first where ACT was used on cancer survivors. Even though the study went well, there are still many unanswered questions that require further research. A few things that were left out of the study, for instance, was how long did a patient have cancer? What type of cancer did the patient have? I'm pretty sure different types of cancer may have different results. There are other personal issues that were not asked by these patients that could have led to different results. Even though ACT is proven to show it can help cancer survivors live meaningful lives during re-entry, there is a lot that needs further studies and in the end prompts further investigation. Thank you for listening to my presentation today. I do have a few thoughts I would like for you to respond to. Tell me what you think about ACT. Can you think of other illnesses or situations where ACT can be beneficial? Besides cancer, can you think of other types of illness including mental illness, where ACT can be beneficial in treatment? And do you have any questions pertaining to the study or on ACT that I can help you with? I do look forward to your responses and enjoy your day, and I hope you're really enjoying this class. Thank you.